The first case of a COVID-19 variant was identified in Georgia earlier this week. It was found in an 18-year-old with no travel history. Our Mary Frances Hoots learned more about it from a doctor at CHI Memorial.
A new strain of COVID-19 has come to the United States called variant B.1.1.7.
When viruses reproduce themselves, there can be changes in the genetic makeup of the virus or components of the virus.
This is not a surprise to health officials. There are a lot of strains for a virus like the influenza, but not for the measles.
The coronaviruses are sort of in between. They don't change as much as influenza. We don't anticipate we're going to see the sort of rapid change where you have to have a different vaccine every year.
Dr. Anderson says the current vaccine can protect people against this strain. But not everyone can get that right now, and the variant is 75 times more contagious.
Almost impossible to really contain it, I think. And I think we're starting to see that.
With the virus spreading rampantly and a possible surge if the variant continues to spread, hospitals could see an increase in patients battling both strains.
It's a worry for all of us if we do begin to see increased numbers. We have plans in place to deal with that.
Dr. Anderson says the new strain has not been around long enough for them to know if someone who has already tested positive can contract this variant. So he believes wearing a mask, social distancing, and getting the vaccine when you have a chance are the best practices to stop the spread.
Thanks to Mary Frances Hoots for that report. Our local health districts in North Georgia were not notified exactly where in the state this variant was identified. That would be a HIPAA violation. That same variant was found recently in the Tennessee Valley.